think there's a couple of issues. Number one, I think we have a cost issue. When you look at the $2.6 trillion we spent on healthcare last year and the waste, fraud, and abuse inside the system, and just the exorbitant costs when you can't really manage where we're going fiscally. And so when you look at outside, we look at other countries, we rank anywhere from 15th to 25th when it comes to outcomes reporting, but yet we have the most expensive healthcare system ×2. Than any other country. So we need to look at that, and I think that's the number one area that we're going to start to get a handle on with accountable care and care coordination, and also from a policy standpoint. Interoperability is key to care coordination and certainly accountable care, and we're encouraging practices and hospitals to engage these conversations and also seek providers of EHRs to make commitments around interoperability. I just got done speaking to that effect a few moments ago, but really push their vendors to guarantee interoperability and really encourage interoperability between systems. I think the largest issue right now is a national patient identifier. We were actually on Capitol Hill last month really advocating for a national patient identifier. It's an essential component to really having the accountable care and care coordination discussions move forward even faster. Most practices and even hospitals have questions on how to best navigate where the future of healthcare is going. So that's care coordination, even interoperability, and certainly accountable care. And so we built a series of solutions to help with every component of that every step of the way. So you can start off with just having an EHR that's highly functional and highly usable at the point of care, moving over to interoperability to make sure that data is sharing wherever data needs to go, that it has the analytics capability behind it and all the data they need to run the reports that they have to run, and really navigate them through accountable care and care coordination. And even further to that, even revenue cycle management. I think it's very important that those types of strategies to really navigate practices and hospitals through the future of healthcare. Our customers have actually been very fortunate with meaningful use. It's a great focus by our customer base, but then also just making sure that they have a solution that they can actually use at the point of care with patients, achieve the objectives, do the actual reporting on time, and then receive their incentives. So we've had several releases where well over $1 million has been received by our customer base. I think now we're well over $1.5 million over the last several months. So a lot of great success, and so a lot more momentum and success to be had. Greenway's taken accountable care from a couple different perspectives. First of all, being a policy leader and really working on the front lines of policy creation, engaging these discussions at the community level and also at the national level, making sure that we're educating our customers on accountable care, where it's going, what the future can hold for them, to be part of the conversation today. I think that we really look out for our customers to make sure that they're positioned the very best in accountable care and wherever the future of healthcare is going. So that's been a real true focus of ours, making sure they not only have the right solutions, but also the right advice. I talked about interoperability and the importance for providers and hospitals to hold their vendors accountable to interoperability. So to really push that envelope and make commitments or have commitments be fulfilled by the vendors. So that is paramount to a successful accountable care organization. Collecting the data that they need to have, being able to analyze that data, and analyze that data inexpensively. There's a lot of systems that are very expensive to get data out of. There's also some new innovative platforms that it's very easy. And so to have access to that data, have access to the interoperability, and really have the agreements between these organizations work successfully, I think is some of the initial stepping points that you have to be successful. We have a very strong interoperability strategy. It's not only Prime Exchange as our interoperability engine, it's a little unique where it's a centralized interoperability engine in the cloud that we've had for well over 11 years now. We've helped all of our customers really access data, share data, import data, whatever they need to do to be a leader in their community and throughout the nation. We've implemented those strategies at the point of care with our patients or with our providers and our customers. But the evolution of that is really making sure that they're navigating accountable care, care coordination through interoperability. And so we've been able to be very successful. And when I say that, I mean also the analytics and the information that we have to have internally, that they have to share to prove outcomes, and then also make sure that they're managing their patient populations. And that's all done through interoperability and information sharing. I think the final rule actually hit on target. I think it's very important. They provided flexibility. They've enlarged it to even have larger provider groups and provider constituencies as part of an accountable care model. They've offered some upfront funding and advanced payment initiatives. So I think CMS did actually a very good job with this. We're still going to see some of the maturations of our industry, but it's very important what Medicare does, but also very important that people engage with the private and the commercial ACOs and commercial payers are doing. So I think it's important to look at both sides and understand that you can have flexibility to work on the commercial side with the private payers. You also can work CMS side and navigate between ACOs that way. So engage these conversations because they're probably going on in your community, and you want to be very well positioned for where the future is going in your community.